Hi everyone, I'm Jenna Callahan from the Powassan Area Family Health Team, and welcome to the Mindfulness series. This video has a specific focus on anxiety and will provide some basic information on anxiety and how practicing mindfulness can be beneficial for those who have trouble in dealing with it. So, on we go. COVID-19 has had a really big impact on anxiety rates in Canada. They've actually quadrupled from 5% to about 20%, um, which is quite a staggering number. So, anxiety is a very present thing. The numbers vary. That's just one of the statistics that I pulled from the Mental Health Research Canada. But of course, that's just those who have been diagnosed. So we don't know how anxiety is impacting everyone if they did not go to their doctor and get a diagnosis. And there's a lot of different types of anxiety disorders. So, generalized anxiety is essentially those who experience excessive anxiety and worry about a large variety of topics, including school, work, relationships, life events, daily activities. The thing with that is that the worry occurs more often than not for longer than 6 months and is clearly excessive, and it's very difficult for that person to control. So, those are kind of the criteria for someone to get a diagnosis of generalized anxiety disorder. Obsessive compulsive disorder is the occurrence of obsessions, compulsions, or both, which is the reoccurrent and very persistent thoughts that are going on within their minds, impulses that are associated with those thoughts. Someone who's obsessive compulsive will try to ignore, suppress, or neutralize these thoughts. Um, and they do acknowledge that these obsessions are a product of their own mind. So, for example, someone who has to turn the light on and off a certain number of times, they realize very actively that this is like, there's not really a huge point behind it other than it's going to ease that feeling of anxiety that they have. Compulsions are the behavior that is associated with the obsessions. So, um, compulsions are acting out the behavior of the obsession. So, repeated hand washing, checking, um, mental acts count as well. So, like some internal things going on. So, praying, counting, thinking good thoughts. Um, it's a compulsion according to rigid rules. And really, what the compulsions do is they aim to prevent or reduce distress or prevent some sort of dreaded event that is potentially happening in the future. So, if someone doesn't shut off that light switch 7 times as their compulsion dictates, well, then something bad might happen, and it's because they didn't do that. Panic disorder is really defined as having reoccurrent and unexpected panic attacks. And usually there has to be at least one panic attack, um, followed by at least 1 month of having persistent concern about having another panic attack. Um, there's also worry about the consequences of the attacks and some pretty maladaptive coping behavior related to the attacks. So, really, one of the big ones would be like avoidance, someone avoiding doing the regular routine because they fear that they may have another panic attack. Post traumatic stress disorder is a direct result of a traumatic event. So, really, what post traumatic stress disorder is very much in the title. It's post trauma. So, after a traumatic event were to occur, stress disorder. So, post traumatic stress, the stress that occurs after trauma and it being disordered. This could be an event that someone could have gone through themselves or heard about, learned about. Post traumatic stress is characterized as having intrusive or re experiencing symptoms of what they may have experienced going through that trauma in the first place. This also causes a lot of avoidance. of things that could be a reminder or a trigger, as we say, of that event. So, for example, if someone is in a car accident, that's the most common kind of thought that people have when they think of a trauma. Well, then maybe that someone is avoiding going into cars, or they're scared of driving. Maybe they're scared of blue cars because that's the type of car that hit them. Who knows, right? And I want to be very clear that trauma is a lot broader than war or car accidents. It could also be, witnessing someone you love pass away. That's a trauma. Um, a breakup could be a trauma. Having a dog bite, or standing up in front of someone and embarrassing yourself. That could be a trauma and could cause those avoidance behaviors, and it could spark those symptoms that you're feeling at the moment the trauma happened. So that's that. And finally, we have social anxiety, which is also known as agoraphobia. This is characterized by fear and anxiety about real or anticipated exposure to socialization or public spaces. Um, Public transportation is a big thing. The anxiety with this is really associated with feeling like they can't escape from this type of situation. So being in a being in an open space, or standing in line, being in a crowd, it's this feeling of almost like claustrophobia, where it's like, I can't leave this scenario. And they can develop very distress-like and panic-like symptoms that go along with that. So those are kind of the 5 major anxiety disorders. However, I want to iterate very clearly that you do not have to be diagnosed with any of those disorders to have experiences of anxiety. Anxiety is essentially a state of preparedness for potential danger. So our body is getting ready to protect ourselves, which is a really important thing. And there's a lot of times when anxiety has been seen as being an amazing thing. For example, when you see those videos online of people, grabbing children out of the way of oncoming cars, or these potentially really bad situations, and they all ended up okay. That's anxiety. Anxiety is heightened awareness. It's muscle tension, our heart gets going. So sometimes anxiety can be a really good thing. However, anxiety can also be a very bad thing. And this is when it starts becoming, when the anxiety response that I talked about, that heightened awareness, when it comes at inappropriate times, like on your drive into work, knowing that you have a big presentation that day, or when you're getting ready to go in and write a test, or when you're just sitting at home and you're thinking about all of the past regrets that you've had and the fact that you can control none of them. So that's when anxiety can become a problem. It's when we have that excessive worry, that obsessive thoughts. And that's what anxiety is for people. So this doesn't require a diagnosis for someone to say that they have experiences of anxiety, because sometimes anxiety is a really good thing and sometimes it's not. And both are okay and they're completely acceptable. So you do not have to be one of those 5 main diagnoses to indicate that you have anxiety. Most of the time, we can just refer to it as being situational anxiety, where it's like, I'm having a lot of stress at work. I have a lot of deadlines coming up. So I'm feeling anxious right now. And that's what those symptoms come from. And I want to make it very clear too that some of you may have listened to me go on about those 5 main disorders and be like, hey, that's me. But before jumping to any sort of conclusions, because I'm very guilty of doing that too, I remember being in my psych class and thinking that I may have had schizophrenia. which I don't for sure. um, what you can do before jumping onto the phone and calling your doctor is to examine what's going on in your life. What are your life situations right now? Is your lifestyle very chaotic and very go, go, go? Are you overwhelming yourself with a lot of things? Are you not able to manage all of those tasks that are going on within your life? If so, that's a very realistic reason to have anxiety that may not be necessarily linked with one of these disorders. The symptoms of anxiety are as listed here. Really, it's the state of heightened awareness. That's what anxiety can be defined as. Excessive worry, muscle tension, elevated heart rate, heightened senses. So, for example, our eyes dilate and blood gets pumped into our larger muscle groups because it's telling us that we might have to either fight or flight. And sweat is a big one. All of these things are just getting us ready to survive. So, anxiety can be very annoying, as the thing that characterizes it is those persistent worries and thoughts, and the feeling that we have of helplessness that's associated with it. It can also bring us to avoid things that we know that we need to do. I know some people have a lot of anxiety about even attending a doctor's office. So they avoid it, even though their health may need a checkup. Um, so for healing, the goal is to stop that stimulated and fearful feeling that goes on within our bodies, and for us to continue on without having any sort of major responses. So that's kind of what we try to practice in therapy, is to bring awareness to those anxious thoughts, although we try to avoid them as much as we can. Bring awareness to them, narrow down what the stressor could potentially be, or the few stressors that it could potentially be, and then work on the body and the brain to minimize those listed effects that I talked about. If we can remind ourselves that, you know, my body's having a reaction, but this reaction is important and this reaction's okay. However, we're not entering a life threatening situation. There is no impending danger. Then we can prove to ourselves and to the anxiety that we're going to be okay. Mindfulness. So, this is how mindfulness can help. Mindfulness is defined by Jon Kabat-Zinn, who's kind of like the father of bringing mindfulness into like the medical rhetoric. Mindfulness is defined as being present in the moment, being aware of thoughts, feelings, sensations, and the environment, but also pairing it with acceptance of everything just as it is. And pulling it back to anxiety, this would be recognizing, oh, my heart's beating really fast. Oh, my muscles are tense. Oh, I'm thinking a lot. And that's okay. All of those things are okay. That's why I talk about anxiety in those kind of physical terms and in those evolutionary terms on why we have these feelings that come, is because they're really important and they're normal. A lot of people who think they have anxiety think that they're not normal for some reason. But when I can explain that to them, that, if you're walking into a test, yeah, you should have anxiety. Like, that's very normal. I would expect that. Then at least it can show that person, hey, okay, this is what's going on with me, but that's okay. The practice of mindfulness can also work towards helping stabilize the mind and decrease rumination. Rumination is that fixation on the past. So when we say we're ruminating on a topic, it's I'm thinking about all the things I did today and how I could have been better, or how I didn't get to that one thing that I should have done today, or that one embarrassing time that happened like 10 years ago and no one remembers but me. That's rumination. We also ruminate about past arguments, and mindfulness can help us go into a state of concentration where we can just focus on our breath or focus on an image like the beautiful one that I have here and just be able to sit with it. And when thoughts come in, because they will, be able to say, you know what, I don't want to think about that right now. I will think about that later and put it away. And when we practice things like mindfulness, it helps us identify and understand thoughts that bring us distress or bring us anxiety, which causes us to have, maladaptive behavior. So, avoidance or anger, those types of things. So, when we're dealing with something that brings us anxiety or we have anxiety in general, our thoughts can really get away from us and we can feel very hopeless in that, where it's just cyclical. Every day is the same. It's always me worrying, worrying, worrying. What's the next thing? What am I doing wrong? What did I do wrong that I can't control? So, mindfulness can help us as a tool for experiencing the intrusiveness that goes on in our own brain, accepting it, and helping us accept the feelings associated and the sensations that are going on within our bodies, and release us from that feeling of being stuck in our own heads. That's kind of the goal. So that's how anxiety and mindfulness kind of overlap and how they intersect, and how mindfulness can be a really helpful tool for that. Imagine if instead of being induced by our panic and trying to avoid our own anxiety, that we could acknowledge those anxieties, thank them for protecting us and trying to keep us safe, and then slowly just focus on bringing our breath back and kind of slowing that heart rate that we know anxiety elevates. And then once our mind or once our body kind of relaxes, then we can start thinking a little bit easier. This would be the goal. This would be how we could begin our relaxation response. Um, our minds can be freed of that overstimulation and begin to recognize the reality associated with our stresses. And we see that a lot when people say, logically, I know that when I go into work, nothing bad is going to happen. But there's this sensation that's there. And we can use mindfulness to calm that. So there is a guided meditation somewhere attached to this. It's just a little 10-minute video that's specifically guided for releasing anxiety. Give it a shot and let me know what you think. And of course, here are some resources that are always attached if you want to check out mindfulness tools on your own. Here are some that are listed, particularly for anxiety. Again, we have the Insight Timer that's free. If you punch in the little search box, anxiety, then quite a bit of them come up. Or if you're willing to pay, or you've tried out mindfulness already and you think that it is something that is helpful for you, then you can try what we call Headspace or the Calm app. You can always just Google, like YouTube, mind calming meditation and see what comes up. And for workbooks, we have the Mindfulness Workbook for Anxiety. We have the Mindfulness and Acceptance Workbook for Anxiety. And we have Calming Your Anxious Mind. So all different books that you can try out on your own. They have great reviews. And yes, that's all. Thank you so much for listening all the way through. And we'll talk soon. Have a good one. Bye-bye.